single death from COVID-19. There has not been a single local case of the virus in the last 3 months. How has Vietnam been so successful in combating the virus, where many richer and more powerful countries have failed? The Vietnamese government's response was quick and organized, and the government mobilized the people to respond as well. Preparations began as soon as the number of cases in neighboring China began to rise, much before other countries took the virus threat seriously. On 16 January, even before it was clear that the virus could spread through human transmission, Vietnam's Ministry of Health informed other government agencies and the people of the dangers of the virus, urging them to act immediately. After human-to-human transmission was confirmed, the Health Ministry issued detailed instructions to hospitals and clinics on tackling the virus on 21st January. On 24th January, the government decided to carry out screenings at all border posts, an essential step since Vietnam shares a 1,400-kilometer border with China. Schools were also closed at the end of January. On 30th January, Prime Minister Nguyen Xuan Phuc established a National Steering Committee on Epidemic Prevention. 2 days later, on February 1st, the Prime Minister declared a national emergency. This early and aggressive response has allowed Vietnam to already return to normal, even as many countries are still seeing a dramatic rise in cases. Apart from the usage of masks, physical distancing, and targeted control, the country has reopened, which means it will also face much less economic damage than other countries. Schools were also reopened in early May. The Communist Party of Vietnam early on issued the motto, "Fighting the epidemic is like fighting against the enemy." In keeping with this motto, the battle against the virus was fought scientifically. Testing was also scaled up massively. Over 100 laboratories all over Vietnam performed real-time polymerase chain reaction tests, which give much faster results. By April end, 27,000 test samples could be processed daily. Extensive contact tracing is carried out for every positive result. A multi-tier isolation system was formulated which enabled Vietnam to break the chain of infection without locking down the entire population. Availability of safety equipment was ensured. The government directed public sector companies to manufacture PPEs, ventilators, hand sanitizers, etc. Vietnam also sent 450,000 PPE units to the US in an act of solidarity. The government deployed different communication methods to disseminate safety information. A music video posted by the Ministry of Health, which explained hand washing and physical distancing, went viral. Announcements, posters, social media campaigns, text messages to citizens. All of these and more are being utilized for information campaigns. To ensure no one suffers from hunger, the government set up food kitchens to feed anyone in need. These efforts were also aided by philanthropists who set up rice ATMs to distribute food to those who had lost their incomes. The Vietnamese government, under the leadership of the Communist Party, has thus been able to combat COVID-19 with its socialist approach. The government's multi-sector response incorporated different branches of the public sector and grassroots organizations. The socialist approach, based on scientific action, public sector production of essential goods, and internationalism, provides a model for others to follow. The fact that Vietnam, a middle-income country with 100 million people, has only had a total of around 400 cases till late July is a testament to the power of this socialist approach.
COVID-19, Vietnam is doing better than anyone had any right to expect. It's a developing country of almost 100 million people with a border with China, and they're already moving into the reopening phase where the rest of the world is trying to get. When you look at the comparison of the US and Vietnam, it's really quite shocking. The two countries in the early days of the outbreak were moving in lockstep. The US reported its first case on January 21st. The first case in Vietnam was 2 days later. And yet you roll the tape forward to today. The US, a country of about 3 times Vietnam's population, has 100,000 deaths and nearly 2 million confirmed cases. That's 3,000 cases per million. Vietnam has just over 300 cases. That's only 1/1,000th of the per capita caseload of the US, and so far 0 deaths. This is incredible. Vietnam responded very aggressively to the early signs of an outbreak in Wuhan. There's a lot of evidence that the Vietnamese didn't trust the early numbers coming out of China. They had seen this with SARS, they saw it with avian influenza. They assumed that this was going to be worse than Beijing was reporting. They moved very early to suspend travel with China. They began very vigorous contact tracing of anybody who had symptoms, and quarantining all the people, not just who had symptoms, but all the people they had come in contact with in a way that a lot of other countries were very hesitant to do. One of the things that became clear early on was that there was an enormous amount of trust from most of the public in what was coming out of the official media in Vietnam. Vietnam's government, despite being a one-party authoritarian state, was quite open and transparent when it came to the disease. It talked about the numbers in a very real way. There's every indication that those are to be believed, and the public knew it. So when it said that areas needed to be quarantined, there was very little pushback. When you compare that to what you see, not just in the US, but in Europe and even in other countries in Asia, it's remarkable how willing the public was to go along with the advice they were being given and how trusting they were in it. Now, the other piece of this, of course, is that Vietnam does have an apparatus of state security institutions and a very light involvement here from the army that helped a lot of this succeed. This infrastructure doesn't exist in places like the United States. Contact tracing in the United States is much, much harder. Vietnam could rely on pre-existing structures of the state that are used for surveillance in order to switch those easily into contact tracing. Over the long term, it's unclear just how much this is going to benefit Vietnam, but it is certainly going to accelerate the move of a lot of foreign manufacturing companies, US, European, Japanese, out of China. That was already taking place, both because of rising wages in China and frustration with the way business operates in China, and of course, the trade war that the Trump administration has launched. The COVID-19 pandemic is just going to speed that up, and Vietnam is the number one place that a lot of those companies are going to be looking to go.
Chống dịch COVID-19, đây là nhận định của nhiều tờ báo lớn trên thế giới khi nói về nỗ lực không ngừng nghỉ của chính phủ và nhân dân ta trong việc phòng chống sự lây lan của virus SARS-CoV-2 thời gian qua. Báo New York Times của Mỹ đăng bài viết nêu rõ, nhờ những nỗ lực sáng suốt chống virus SARS-CoV-2, Việt Nam đã đảm bảo tỷ lệ lây nhiễm virus thấp hơn so với nhiều nước láng giềng. Trong khi đó, tờ Das Welt của Đức phân tích nguyên nhân thành công của Việt Nam trong cuộc chiến gay go này, đó là Việt Nam đã thực hiện một hệ thống giám sát công cộng rộng rãi, sử dụng lực lượng có kỷ luật, tin cậy để tham gia chống dịch. Chính phủ đã ví cuộc đấu tranh chống dịch bệnh như cuộc chiến chống giặc và huy động người dân tham gia, trong khi chấp nhận tổn thất kinh tế không nhỏ.